Good evening, Golden. I am Mayor Laura Weinberg, and with me here tonight for our briefing is our city manager, Jason Slowinski. I'm also very pleased to say that tonight we also have joining us Councilor Jim Dale. I will start out with just a few comments and passings over to Jim to touch on the public health side of the COVID-19 pandemic. And then we'll get some updates on what's happening in the city from our city manager. The first thing that I wanted to say is that our society is really facing two crises right now, one of disease and one of injustice. Both are taking a devastating toll on mental health. If you find yourself in uncharted emotional territory at this time, know that you are not alone. Please remember that Jefferson Center for Mental Health is here and has excellent information, resources, and caregivers available. You can visit them at jcmh.org or call them at 303-425-0300. Since this is our COVID-19 briefing, we will not be providing updates on other topics or the second crisis that we are addressing. But I will mention that a vigil and rally was held on Sunday in the park and saw hundreds of attendees. Everyone, or almost everyone, was wearing face coverings, and distancing could be achieved due to the size of our Parfit Park. I'm going to echo the governor's words and encourage anyone who was involved in the rally here in Golden or participated in a demonstration in Denver or in another location that you get tested about a week afterwards. If you have symptoms, certainly get a test sooner. But if you do not, then about 7 days after is a good time to get a test. Free tests are available at the Pepsi Center in Denver, or you can visit covid19.colorado.gov for other test locations. The city continues to encourage a mask-wearing culture here in Golden to help our businesses reopen and stay open, and to help employees and community members stay healthy. There are some amazing artists in our community, and the city's Public Art Commission is hosting a Wear Your Darn Mask poster contest. Send your best ideas by the end of the month, so due on June 30th. You can send those to covid19@cityofgolden.net. The winner will receive a cash prize, I understand, and have their design featured around town. I am really excited to see what you all come up with, to see your artistry and your creativity, to help people in Golden and visitors to Golden to remember to wear their darn mask. So that's all of the quick updates from me. We are fortunate to have an expert in public health here in the city. Jim Dale spent his career in the Air Force and a second career in Jefferson County working in public health. And for some important information with certainly a lot more knowledge behind it than coming from me around COVID-19, I am going to turn things over to our Councilor, Jim Dale.
Well, thank you, Madam Mayor. And this is really unique, citizens of Golden, be in council chambers with very few people here and sitting way down here on this end in Councilor Hazeman's and Councilor Reed's position. But you might ask, why is your Councilor Jim Dale here to talk to you about public health? Well, I'd like to echo some of my credentials so you know about what the mayor was speaking. I am a veterinarian. I'm a DVM from Kansas State University. I have a master's in public health and epidemiology from University of North Carolina. I have an MBA from University of Utah and a graduate certificate in veterinary homeland security from Purdue. And that homeland security is about looking at exotic or foreign animal diseases and knowing how to prevent them and stomp them out. I'm also a diplomat of the American College of Veterinary Preventive Medicine. I've taken 2 summer short courses at the University of Minnesota in epidemiology. I'm the past chief of public health, the chief of health promotion, then the chief of prevention for the United States Air Force at the Surgeon General's office. I was here and working for Dr. Johnson in Jefferson County Public Health as a chief of environmental health for 12 and a half years. And since that time, I've been a student of public health. I also got to serve as the president of the Colorado Public Health Association and a past member of the APHA Executive Board. Therefore, you can tell I'm eaten up with public health. And for me and for you, I think, and for many others, we believe it's a good time to reflect on the basics of epidemiology so we can understand more about this COVID-19, also called SARS-CoV-2, SARS coronavirus 2. And we sometimes just call it coronavirus. But today I want to talk to you about models. And you will hear people talking on TV and radio and in print about all kinds of models. But models are a good way to inform us. They help us to better understand epidemiology and disease, that's for sure. But one of my infectious disease heroes, Dr. Michael Osterholm at the University of Minnesota Center for Infectious Disease Research and Policy, says, all detailed models are wrong, but they help inform us. So let's talk a little bit about providing a way for you to look at COVID and for me to review it in general, and then we can dig down into the specifics of COVID-19. So, speaking in general, for those of us who have been watching hours of Zoom conferences on COVID or reading intensely in the social media about it online, some of this stuff will be basic, but some of it is something that helps us reflect back and know more about disease. So if we go back to the basics of the disease model that we can apply to COVID, we know that diseases happen through an event, and it's an event that relates between a host, that's somebody that gets sick, an agent, something to make them get sick, and an environment would be a place where they could come together and have this event happen. And there's a number of factors, whether it's host factors or agent factors or environment factors, that impact on this disease or potential disease event. Now note that I am talking about 3 corners, and that makes a triangle. And a triangle is a very strong structural item. But if you knock one of the legs of the triangle out, the whole thing collapses, and that's the same way with disease. So we can take and try to understand disease by looking at the relationships between the host agent, the host environment, and the agent environment legs of the triangle. So you might ask, and I do, what is a host? Well, a host is a man or an animal. And with COVID, the original host was were bats. Now, I forgot to mention that I'm a conservative studier of zoonotics. Those are diseases of animals transmissible to man, and that's something that I really enjoy. So when we talk about bats being a source of the COVID and then getting it transmitted over to man, that really becomes interesting to me. And the reason we feel comfortable as saying it came from bats is because if you look at the genetics of the virus, it's similar to some of the genetics of the other bat coronaviruses, and there's a lot of coronaviruses. So what is COVID? Well, it's a virus. It's a biological. Because when you look at agents of disease, they can be either chemical, physical, or biological, and the virus is biological. And that's very important for us to remember, and we'll reflect on that a little bit more. And as for the environment, that's where, like I said before, where the host and agent get together. So let's start by talking about bats and man. And as I mentioned before, the bats, we're pretty sure it came from there because of the genetics of this individual virus of COVID-19. And that's probably where it originated. So it's transmitted to man, therefore it's a zoonotic disease. And we should remember that with any disease, with any one of these biological diseases or any disease, the only way the disease agent can get into our bodies is through our skin, penetrate our skin, get in our eyes, We can eat it or we can inhale it. And COVID-19 has adapted well to inhaling of these viral particles, and probably even get in our eyes too if we get it on our hands and rub our eyes. So in general, our bodies are very smart, and we have to get an effective dose to get this COVID thing. In other words, we have to get enough of the virus particles. And by the way, we don't know, quotes, what enough is. But our body's real smart, and it'll try and fight off small numbers if we just walk by a COVID-contaminated airspace or something, and it'd fight them off. So we have to get enough viral particles because this virus is adapted very well to man, and it's pretty easily transmitted through respiratory droplets and aerosols, and there's some discussion about whether or not it can be transmitted through feces because virus particles have been found in the feces. Now, it has stricken some more than others. So if you're like me and you're over 50 or over 60 and I'm over 70, the people who are infected by this disease, it keeps going up in numbers and rates of disease for us. And particularly those like in senior care homes who might have some health issues. And particularly another group is the immune compromised, or those with other diseases or conditions that can compound their health and make them more liable to get infected. But you can have COVID and you may not even know it. You may be asymptomatic. You're not sick, or you get a little bit sick, or the whole spectrum of disease clear out here for hospitalization and sadly death. Furthermore, some can be what we call super spreaders, and they shed a lot of virus. So when they speak, when they sing, when they shout, and just when they breathe, they could be discharging clouds of viruses into the environment. Let's talk a little bit more about this agent. We know it's a virus. We know it's coronavirus. And we call it coronavirus because it has, when you look on an electron microscope, it has a nice spiky crown. If you haven't seen the pictures of it, it's beautiful for a bad guy. And it doesn't tell us its secrets easily. It's very sneaky, and we're still learning. There's so much more to learn about this virus. But we should note this. COVID-19 is what we call a novel virus. That's a new one. That's one we haven't seen before. It hadn't been previously identified, and it's one that our bodies, the human bodies, have not seen before, and therefore our bodies are trying to figure out what the heck to do with it. And viruses are unique in that they only replicate, they only reproduce inside of a living cell. If a virus is out here in the environment or on a surface, it's not reproducing. It's just laying there waiting for a chance to get inside of a living cell where the genetics of a living cell will allow it to replicate, duplicate, and eventually just bust that cell open and run out and infect other cells. Thus, it takes a while to do this, and we call that incubation period before we start showing symptoms of disease. And the incubation period is a period of time before we get disease. And the mayor was talking about, well, 7 days is a pretty good ballpark for getting tested if you were at the protest, and it's a wise thing to do. And we'll talk about testing a little bit later on. But this quarantine period made to 14 days kind of put some outside limits on it so that you probably, if you don't have a 14, you're just fine. And most viruses, general, 5 to 10 days is their incubation period. But that's not the case with COVID. We just don't know for sure. And we think that COVID can be, we, the experts would say, those that I read would say, COVID can be transmitted before we know we have it. Now, even today in the news, and yesterday, there's a brouhaha with the WHO, the World Health Organization, about whether asymptomatic carriers were important in transmission of the disease, and obviously they all didn't agree at the WHO, and so the one person had to pull that back. Can they easily transmit? I personally believe that asymptomatic carrier can do it. Now, there's a whole bunch of coronaviruses, and I've talked about how they have the spiky crowns, and that's why they call it coronavirus when they look like it. Those viruses include things like the common cold that we have all the time, but it also includes some bad actors like SARS, which is a severe acute respiratory syndrome that we saw a number of years back, or MERS, the Middle Eastern respiratory virus syndrome. And all these are just some among the many coronaviruses, and some out there in the wild that we've never seen. And they explode on the scene like this one did, similarly to Ebola or a disease such like that we have never seen before. By the way, Ebola is not a coronavirus. Now, it's been around for a while. It's been around for a while in China, and we know it's been there pretty sure since December. But what did I read yesterday or the day before? GPS data in China has showed that hospitals were in late summer, early fall, were having a lot more activity than they normally would have. That led some GPS watchers to say, hey, this disease has been around just a little bit longer. So, again, we still have a lot to learn about this virus. It's here. Now, we've flattened that curve, but it's not going away. We've only had a small percent of our population, smaller percent in some places, bigger percent maybe in some place like New York City where there's more crowding. But it's still around, and I don't see it going away. And there are some early indicators that we may, if it follows the course of the 1918 flu epidemic, and it's not a flu virus, but it's a virus, we may see a second wave. And some are predicting a second wave in the September, late August, September, October timeframe, or not. So we flattened it down. We may have to flatten it down again, and it may come in more than one wave. And as Dr. Osterholm from Minnesota likes to say, we still don't know a lot. But I'll tell you this much, time will tell. So that's about that virus a little bit. Let's move on to the environment. What is this environment? And as I mentioned before, the host and agent get together in an environment. And the environment can be like the following. First, your environment is your air. Your environment are the surfaces like where I'm putting my hands right now and touching. The environment is our fingers and our hands. And remember, wherever that environment is, we still have to get enough, and put the quotes around enough, of the virus in the environment for us to get it. So if we start on air, as far as air goes, studies and reviews by panels of experts and experts say outside is better than inside. And that may be because the solution to pollution is dilution. So if you go outside, you dilute that virus that might be expelled in the air more. We also should know that it takes time to get enough of the virus, and that drives disease. And the concentration of something over time can get enough of the virus and drive disease. So we can say far is better than close, and barriers are better than no barriers. I think that makes sense. If you got a barrier, it's better than not having a barrier. So let's talk about surfaces a little bit. If they become contaminated with droplets, that'd be a cough, and maybe larger particles go out and land, and those particles happen to have, or they could be aerosols, or the surface can be contaminated by touching it with an adequate dose, then surfaces can be a source of disease because we're touching. And you're getting the picture, and then there's the fingers and the hands that touch surfaces, and the surfaces, well, lots of things can be surfaces, whether it's tables, chairs, rails, masks even that we put on, and if we're around somebody that have it and the contamination gets on our mask, and even doorknobs. I used to laugh about talking about disease from doorknobs, but you can get disease from doorknobs if, and only if, you got enough of the virus on the surface. You got enough of the virus on your hands or your fingers when you go to touch your face or go around your mouth or to inhale it. And so that's why it's so important to be washing our hands, because our body's smart and it wants to fight it off. It's smart, it wants to fight it off, and it can fight it off when it coughs out bad stuff or sneezes out or even makes body fluids, but you get enough in there, it just can't fight it off, and the killer cells in the body are not prepared to face this new novel virus. The body just doesn't have its A-team available to fight this virus because it's brand new. It doesn't have its A-team defense. So we have no treatment. We have no vaccine. I got a chance to listen today to the APHA Conference of Medicine's 1-hour COVID information conversation on vaccines and vaccine development. And there's vaccines out there. There's 60 to 200 being developed, and there may be some here by the end of the year for experimental use. I'm not too fired up about being the experimental use one unless I really was in trouble. But they're on the forefront, and there's a whole bunch of different kinds that will be out there. So as we talked about the environment and the host and the agent of triangle of disease, we know about it. Now let's put it on this novel disease of COVID. We need to break 1, 2, or even all 3 legs of this host agent environment. And how can we do it? We'll just look at the host environment leg first. Well, it's pretty straightforward how we can stop this, and we are doing it. We're going to avoid that environment where the virus is. We're going to clean that environment where it is. We're going to wash that environment, and we're going to wear a mask or face covering. And when we avoid the virus in the environment, we're going to prevent getting it. And if we clean and remove and sanitize viruses from the surfaces, we can do that. And if we wash our hands or use hand sanitizer, we're doing good. And for those of you who might remember, how do we learn to wash our hands? We sing the ABC song, and washy, 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 ABCD, you know, or sing happy birthday too. And then we dry with a disposable towel or air dry. Please don't reuse towels and dry with them. Now there's gloves out there, and we worry sometimes about gloves. And I sometimes wonder if I'm looking at the camera off in the distance, but I think I'm doing all right. If you're going to wear gloves, they got to be clean. You got to have clean hands going into them, and when they come off, you got to wash those hands too. So gloves, we don't want gloves or masks to make us complacent. And then there's masks and face coverings. By the way, if you're going to cough in your sleeve or sneeze in your sleeve, and that's really important. So what's this thing about masks? I just published an article on my Facebook, and we'll talk about it a little bit later, but if you're going to be around people, wear your mask. You wear it to protect yourself. You wear it to protect others mostly. That's just in case you are wearing it and you have it and you don't know you have COVID. You don't know you have it, so when you have it up there and you cough or sneeze, it stops the vast, vast majority of those droplets and aerosols. And then if somebody else has it, you know, up there, it may not be perfect, but it's better to have a barrier than no barrier. Why do I say that? Because there's been a lot of studies, and they show that it helps prevent disease with face masks covering, and it eliminates droplets and even some aerosols. Then there's the host agent leg here, and that's just a little bit of the repeat. You know, you avoid the agent. You stay 6 feet away from it. That's why we have social distancing. You wear the mask, the face covering if you think you're near, and you wear a clean, sun-sanitized mask. You can use a mask again and again. You just got to let Mother Nature dry it all out, kill those viruses, and they're not going to stay around on your paper mask for over 3 to 5 hours, 6, and just wash your bandanas, and that works fine. And, by the way, wash your hands a lot. And if you're around somebody, if you think you've got your clothes contaminated, wash those clothes. Lastly, there's the agent environment leg, and it's the same thing. You got the agent, you got the environment, wash it off, clean it, sanitize. You prevent it through good hygiene. Well, how are we doing here, Mayor? We got some more time or not?
You're doing great.
All right, let's talk about some other issues, because there's a number of other issues out there. Number one, the virus is out here, and it's not going away. Think of it. We've only got 2, 3, 4, 5% at the most of Americans that have been exposed and had it. We don't even know if they're immune to it. We don't know what we don't know. We have a lot to learn about this virus, so we got to keep doing it, working it, keep on keeping on. The immune compromised out in our communities are at great risk. Think about them. The people in our senior facilities at great risk. Think about them. If you're have a loved one in a senior facility and you're going to get a chance to visit them even out over in London, maybe you should have been wearing your mask the 14 days before you went to visit them too. Let's not put them and people like Jim Dale at greater risk, just because I'm 76, but I'm not under the dirt yet. If you have a pre-existing disease like diabetes, high blood pressure, chronic obstructive pulmonary disease, asthma, or something like that, you're at greater risk. And like I said, over 50 at greater risk. And if you're not fit, if you're overweight, if you smoke, or you just lead a sedentary lifestyle, you're over risk. So if you can, avoid, clean, wash, take care of that mask, and cover. Now, there's some other issues out there. And I could talk a little bit about testing if you'd like for me to talk about testing. Okay, testing can help, but it has its limitations, along with the important thing of contact tracing and quarantine. Let me digress to contact tracing. I just read in the paper that the governor and his team are working on getting us 800 AmeriCorps and senior volunteers to come out and do the contact tracing. The reason this is important is that if we do find a hot spot, we find somebody who has the disease, if we can follow up and find those people who might have been exposed and help them not get the disease or make sure they don't have it or transmit it, then we can help stop this epidemic and prolong the epidemic so that we won't overstretch our resources, and fortunately, we flatten the curve. So let's talk about testing. And we'll talk a little bit about the good, the bad, and the ugly of testing. Now, there's two types of tests. There's a test for the virus, and there's a test for the body, and the test for the body is a test for antibodies. So let's first talk about the test for the agent. And the tests for the agents typically are polymerase chain reaction tests. Those are PCR tests. And the tests for the body are antibody tests, and we'll talk about them. So let's talk about PCR in Jim Dale terms. That means I'm going to try and say it in ways that I can understand. What's the process? This polymerase chain reaction machine help-driven test is looking for a segment of the virus. The virus is this thing with all these nucleic acids and stuff together, but we look for a unique segment in that virus to say it's there. So you take a sample. It could be a human sample or a surface sample. And then lab equipment will take that sample and amplify that, make more of it. It's magic. I can't completely explain it. And then the sample is checked for presence and absence of a bunch of those segments that have been amplified. If it's positive, that's good, because it's only good if it's positive if you're sick. If you're not sick, we're not sure. It probably is a complete virus, but it could be a particle. If you remember about the cruise ships had them all cleaned up and went back in and tried test areas for PCR, and they found a lot of virus. No, they found a lot of particles that had been broken up and killed by the sanitizing efforts on the ship. So we got to remember that one of the drawbacks is it's looking for this segment and not for live viruses that can cause disease. And what if you didn't do a real good job of taking that sample and you didn't get enough of it to get in the test, but you still had it there? So those are some drawbacks of PCR. Now let's look at, but PCR is real important, and it will help us to identify a number of people that are either asymptomatic, pre-symptomatic, or sick. Antibody tests, the great hope, we thought. Well, these are tests for the body's response to a virus. The big one out there, the best, is the ELISA, or the enzyme-linked immune sorbent assay. The thing it tries to answer, is the body making antibodies? Is the body making early antibodies, which are different than late antibodies? In this process, as opposed to testing with a swab or something, we have to have blood serum, and serum's what's left over after clot blood. You take that serum, you've seen these people pipetting a whole bunch of stuff into wells on a plate that has little wells in it, chink, chink, chink. If you haven't, you're staying away from the news too much, but anyhow, You take this serum, you put it in a well, a little tiny cup that has some COVID markers in it, some COVID material. That serum, if it has antibodies, it reacts when we incubate it and make it warmer, and will cause a clump to appear, and then the machine can read whether or not there's a clump in that little dish. And it says, oh, we have material there. It's going to be positive or negative, except on a super-duper ELISA test, which is called quantitative, and we won't talk about here. But the question is, did we get the right amount of sample, and did they really have antibodies? Now, there's a bunch of drawbacks to antibody tests. We got a bunch of products on the market. They said bless them and let them go out there without FDA approval. And you can get false positives. That means it says it's positive, it's really not. And you can get a false negative, which means you really got it and it says you don't, or you had it and you didn't. And this is where some terms get more complex come in. Sensitivity and specificity. So you could have it. False positive means it's positive and you didn't have it. You don't have antibodies. False negative, it means you did have it, you have antibodies, but couldn't find them. Sensitivity says, oh, my test is so darn good, it can pick up any antibodies. Man, it can get all those. Specificity says, hey, this is COVID-19. So you're trying to find a test kit that does both of those, and we don't have them for sure out there. We don't have them. Some of the best are doing a pretty good job, but the more people you have that haven't been exposed, the more likely it is you're going to see false positives and false negatives. And that's another discussion for statisticians. Second antibody test I'd touch on would be the dipstick test. Oh, great. Finger prick, put that blood on that dipstick, wave it around, let it cook a little bit, stick it in a machine, and the machine will tell you by color changes and stuff whether you've got the antibody or not. And guess what? Didn't work too good. They were trying it in the White House and it wasn't working too good. And there's a number of drawbacks with that because it's just not reliable, and we know that. Well, we've touched on a whole bunch of things so far. We've touched on the relationship between the hosts, that's us, the agent, the COVID-19, and the environment, these things we touched that we walked through. And we know how we can do better to prevent disease now, I hope. If you're interested in this like I am, you can follow me on Facebook. I have I got a Facebook page, Jim Dale for Golden, and I try to put some of the best articles on that. And then I have James Dale Facebook page, and then I post all kinds of stuff on that. But I follow certain experts that I really respect. One is, we always can go to the Centers for Disease Control. Have they made mistakes? Sure. They're the best show in town, though. We can always go to Dr. Mike Osterholm in University of Minnesota at the CIDRAP, the Center for Infectious Disease Research and Policy. And Michael does a podcast about an hour long every week, and I've been listening to almost all of them. And I love his sense of humor, his cynicism about how much we really know. And here he is, he's been doing everything from time he was young, doing toxic shock syndrome, and today he's doing COVID work. And he predicted this 4 years ago that we're going to have a massive pandemic of something, whether it's flu or something like this. I like to go to cidrap.org, and you can get a daily newsletter and get more information than you probably know. What else? We could always go to read what Laurie Garrett says with the Council of Foreign Relations. Laurie Garrett's one of my heroes. She wrote The Coming Plague and The Band Played On and other books on healthcare. Laurie is part of that, of their panel of experts at the Council on Foreign Relations, and I got the pleasure of getting to listen to her, and I've heard her speak before, and I've read her books. Another person I like to follow would be Dr. John Herbold, who happens to be a PhD epidemiologist. He's also a veterinarian. He's got too many degrees, and he is very thoughtful and cynical, and you will find him if you go to my webpage. So, with that, oh, you can always call me and you can always email me. And you can find me on the city website or in our golden newsletters. How's that? Is that enough for tonight?
That's fantastic,
And
Jim.
I look forward to answering any questions or not being able to answer them and finding you answers. Thank you very much. It's fun to be here.
Thank you. Really appreciate having you here and sharing all of that information, some additional resources. I do follow your page on Facebook, so I've seen a lot of those resources, and it is great information to hear from the experts.
I forgot to mention Dr. Aaron Bromwich. Dr. Aaron Bromwich burst on the scene with a post that he did on airflows across tables in restaurants and how a dose of disease transmits across. And when people started reading Dr. Bromwich, who is a professor at Dartmouth, a PhD with some veterinary background from either New Zealand or Australia, he just burst on the scene. And then he followed that up with a wonderful article. What is this mask thing? I think that's the article. You read those two, you just go to Aaron, E-R-I-N, Bromwich, B-R-O-M-A-G-E, online, and you'll find his website. And those articles are some of the best explanations, clear, to the point, that I've seen. So he's one of my other heroes. Thank you, Mayor.
Well, and we're at this stage here. It's been a number of weeks, it's been a number of months since we've had cases here in Colorado, in Jefferson County, in Golden, and we're getting to the point where we are reopening. And a lot of folks think reopening means the threat is past and the danger is past, and it's really important and really helpful to have all of the reminders that the disease is still spreading and how we can keep ourselves and ourselves safe and our businesses and city able to reopen and stay open. So the city manager is going to talk a little bit about things that are reopening and other updates from the city. But I hope we all do, as we're reopening, keep in mind that the spread is still out there. There are still new cases every day here in Golden, here in Jefferson County, and here in Colorado. So Jason, you want to take it away, give us some updates?
You bet. Thank you, Mayor. Good evening, Golden. And I don't know that I can follow that. That was, I joined the mayor in saying that was a lot of great information. Counselor, I learned a lot myself, and I really appreciate you sharing that. That's very helpful, I think, for all of us to understand more. What Counselor Dale mentioned and the mayor as well in our opening remarks, I heard again on a call today with state officials that from CDPHE that we're trending in the right direction and things are looking good, but this is not the time to sit back and relax, and we're not returning back to a normal setting because we still have to be diligent in our social distancing practices and mask wearing efforts, because they all are predicting additional cases in the fall. And one of the interesting things they mentioned, and I'll share this because I think you'll probably find it most interesting, Counselor, is they're working on a modeling tool that they hope to roll out in a couple of weeks to the general public that allows you to control some of the key aspects of what Jim was talking about. And then you can see the impact on the curve and what that looks like going forward. They haven't released it yet. They were giving us kind of a sneak peek on it, but I hope to have that out to the public soon. And it controls some of the. You can control for some of the scientific aspects of this pandemic, as Jim was mentioning, and see how that exactly plays into the overall projections going forward. So really interesting stuff. To pay attention to. I just have a few updates from the city standpoint that I'd like to share. The mayor mentioned our mask campaign. We continue to work on that. We will be rolling out new aspects of that in the weeks ahead. Not only design contests, but also helping to create a culture of mask wearing by making them available to folks in the community, to our visitors, and having additional signs and other activities as we move forward to help encourage that, and taking more of a positive, encouraging approach rather than penalties and enforcement, which doesn't seem to work as well. So we'll work with the business community and others in the community to keep promoting that as we move forward. In terms of our city facilities, I have some updates to share for you, and part of what Councilor Dale was talking about is what we rely on our local public health officials and state public health officials to inform how we go about reopening things in the city. And so the updates I'm going to share with you, and as we look at additional measures to reopen some of our facilities and services, these are the things that we're following and relying on the expert advice of our local public health officials. Our municipal court reopened June 1st with special protocols of social distancing in place with a limited number of people in the court at any one time. And it, reports from our municipal judge, Michael Goodby, were very positive that things went very well. We didn't have any issues, and so we'll continue to operate the court under those special protocols on Mondays. Our city hall and administrative offices will open starting again next week by appointment only. We're really looking at Tuesday through Thursday for appointments. So if you do need in-person service, contact us, arrange an appointment, and we'll be happy to assist you in person. Starting next week, we're not going to open Mondays because we're going to reserve that date for our court hearings to limit the number of people we have in this building. And then also not on Friday as well. And part of having a shortened week is going to allow us to flex our staff in and out and not have, we're still trying to reduce our in-person workforce by 50%, which is we've been able to accomplish, but we want to continue to do that for a while per the public health recommendations. So that's going to help us be able to do that. I know a couple of things that folks are really interested is Splash. The first one, we anticipate potentially reopening Splash, a limited opening, I should say, in the next several weeks. I don't have a specific date yet for you. We're working on figuring out when that could be, but we'd likely see a lap pool only opening because that's where we're able to control a little bit better the number of folks in the pool and spaced properly. And we would operate a reservation system so that we don't have overcrowding at the pool. And it would be definitely a scaled back version, so you wouldn't have some of the things you might be accustomed to when you go to Splash, like concessions and so forth. We'll have more information on that, and we'll release that as we develop the plan and an opening date. But we're in the process of getting that together and hope to be able to do that soon within the next several weeks. Golden Community Center is also looking at plans to reopen. We're starting camps next week there. And we had a variance request issued or submitted by Jefferson County to CDPHE, which was approved this week regarding gyms and pools and other things. And there was an amendment to that today, which I haven't had a chance to really look over and study too closely. But those are things we're looking at, those recommendations, which talks about all sorts of things from a number of folks allowed to spacing to class sizes, et cetera. So we're going to study that a bit more. I don't have a specific date for Golden Community Center. As I mentioned, the camps will start, and once we have that running, we'll know how much space we need to properly make sure we have space in those, and then we can be looking at reopening our gym facilities and other things there. So stay tuned for that. If you have questions on any of our current city services, you can always find the current status on guidinggolden.com, and we update that daily. So we'll take a look and make sure we put all the current dates on that website. So that's the best resource if you have immediate questions. And then lastly, I'll mention under the new recreation guidelines issued by the state, we have reduced our restrictions on Clear Creek and allowed for kayakers to return. The creek is still closed to swimmers and tubers, and part of that is now due to some of the flow we're seeing, but kayakers can again take to Clear Creek. We still recommend social distancing and as much precautions as you can take, obviously. Playgrounds have reopened in the city with restrictions. We have, as has our skateboard park at Ulysses Park. We've posted signs with current restrictions The playground shouldn't be used by more than 10 people at a time, and continue to have social distancing. We're working on putting some sanitizing stations near our playgrounds, so we hope to do that soon, so you have that convenient to you. But those have been reopened, so you should notice that as you're out and about. And then, we discussed a little bit at our city council meeting last week about resuming in-person council meetings, and we'll wait a couple of weeks on that before making a final decision. But our goal, if possible, is to reintroduce that in July, and if not, if things aren't looking well, we can continue with the virtual meetings, which have been serving us well since earlier this spring. Our next meeting is tomorrow, June 11th, and we'll be talking about our budget updates related to coronavirus on our 2020 budget, and also have some discussion around CARES Act funding. So I just wanted to highlight that here. In the event you're interested in that, please tune in. And then lastly, I would mention that we continue to make adjustments to our downtown Washington Avenue setup to help businesses. So you'll see out there fencing. We're moving it around from time to time to help individual businesses expand out into the right-of-way, which was council's direction a few weeks ago. And we'll be establishing a email address, which I think is live today, recovery@cityofgolden.net. And this is specifically for folks who have, in the business community, who may have questions or want to reach out to us directly about some of the plans or have suggestions for us. This is a way to share those with us, and we can get back in touch with you and help work through whatever issues you might be experiencing. So those are the updates I have for you today. Yes, sir.
Oh, I've got a couple other updates before we open for questions. Did you have a
Quick
update?
pop-up, because Jason embarrassed me. I did not mention local references. Always go to Guiding Golden, look at our COVID recommendations. The weekly digest from the city has good tidbits about what's going on with COVID. And thank you, Barb Warden, for publishing stuff about Golden and about the community. And thank you, Jefferson County Public Health and CDPHE. So there's 5 more references on top of what I told you, and I'm embarrassed I didn't remember to say them in the first place. Thank you.
Thank you. The 2 other updates that I wanted to share are not specific to the city, more regional. RTD has announced that they will be resuming their fare collection and front door boarding on July 1st. They had suspended that. I don't remember how long ago. It's been a little while, but they will resume those normal business practices starting on July 1st. They are encouraging, and I personally would encourage, that you buy your tickets through their mobile ticketing apps. There's that opportunity to purchase through your phone, through a mobile device, so you do not have to use ticketing machines. The second is Jefferson County Public Schools. They have, I believe they're calling it a restart plan that is out for review and input. So if you're interested, concerned, curious about what Jefferson County Public Schools are considering for the fall for the K through 12 students in the district, please do visit Jeffco Public Schools website and look for the restart information. There's a presentation, there's the options and plans. So that is out there and available for your review, and they're collecting feedback through this month. So those were the only other 2 things I wanted to mention, and I think we are ready for any questions that are out there.
Okay, first, we have a couple of Jim Dale fans in the audience. So we have an I Heart Dr. Dale comment and a Thank You, Jim comment. So there's some fans out there. We have a question from Joe. Mayor, did you lift the mask ban? I read an article and it says that the ban is lifted. Personally, I think it's a poor choice. We aren't even close to being safe.
So the city council discussed masks or face coverings twice. Neither time did council vote for a ban, so nothing's been lifted. Not sure where they read that. Wheat Ridge did have a change in their face covering practice, so perhaps they read about Wheat Ridge. On June 1st, Wheat Ridge implemented a resolution similar to Golden in that they are requesting face coverings and supporting all businesses who want to sign and provide signs requesting or requiring face coverings in their place of business. That's the route that Golden took both times we had the discussion at City Council that we would strongly encourage a face covering campaign and strongly support businesses who want to post signs requiring it and make sure that we can back them up with enforcing that. But council never voted in Golden for any kind of specific rule on face coverings for the city.
We had several questions about when the community center would open, when the gym would open, when the swimming pool would open. I think those were addressed. But we do have a question, when will tubes be allowed on the creek?
It's a great question that I'm not going to be able to give you a specific date for. One of the things we're dealing with now is some of the flows that are above where we typically would be at this time of year in prohibiting tubing. So if I had to predict, I think in the next several weeks we might be at a place where we can start allowing that. But again, a lot's going to depend on the water conditions that we have and also where the current pandemic is at that point in time. If we are seeing different data than we are now, we may have to adjust.
Okay, and we had Margaret who had requested some information about walking tour maps that are available.
So one of the great ideas and promotions during this stay at home and safer at home has been a lot of virtual activities or things that you can do independently in Golden. And Visit Golden has been a great resource for promoting those. So the Visit Golden website, I think it's just visitgolden.com, they have the resources to conduct your own walking tours. So you can get a map. It will provide you with both the directions as well as the sites that you will see, and it's a great thing to do as an individual or with your family when walking around Golden. Get a little bit of information as you walk. So that was visitgolden.com.
And the visitor center is open with barriers and with proper social distancing. So you can get more information again from the visitor center.
Yes, they reopened just, I think on the 4th or,
Yeah.
just recently. It's great.
So, yeah, just to clarify, the visitor center is open, but the building is not open to the public. They've brought the volunteers out
True.
to the front porch, and you can walk up there, and they're as helpful as always, and behind plexiglass, but I have all kinds of information for people wanting to visit Golden. We did want to thank Christina, who has sent in some great photos of some of our statues around towns wearing masks and face coverings, so we just wanted to give her a shout out. I don't have any other questions at this moment.
Terrific. And thank you, Christina. I loved the photos of the statues with face coverings. Really fun to see around town, and part of that encouraging people to wear their darn mask. So that is part of the campaign. We do need some great signage that we can use throughout the city. Something that is not just generic, put out by the state or by Jefferson County Public Health. They do a great job on communication, but we're Golden. We need our own. We need our artist community to help us with some specific imagery and messaging that we can all really appreciate seeing around town. So make sure you submit your poster contest ideas before the end of the month.
Okay, we did get a couple more questions. Casey would like to thank Dr. Dale for the excellent presentation, and would Dr. Dale be willing to demonstrate the proper technique for howling at 8 p.m. to show appreciation for our critical care workers?
Fantastic.
Challenge. And a question from Joe, who asks, for the City Park Pavilions or the History Park, are those reopened for reservations, and what are the group size limits?
For which facilities? I missed the...
For the City Park Pavilions, the pavilions that are available for rental.
I don't believe they are yet, but I will double check I'll check into that tomorrow morning with our staff, and we'll post that information on our website as to when we might expect them to be open, if they're not already. I just don't have that with me handy.
I think they're open, but not for reservations or, I think when the playgrounds reopened, a lot of that, but I don't know
think you
about
c-
the
yeah.
reservation.
I think you can use them, but I don't know that we have our reservation system still taking them. But I'll verify that, and I'll make sure we put that out there.
Okay, and we have a question from Laura, who would like an update on hiring rangers for summer 2020.
I believe we're still looking for rangers, so if you're interested, please visit our website, and you can find information there. We have rangers on board, on staff. I think there's one that's in training now. So we do plan to have them out and about along the creek during the summer, and as we normally have. And also part of their responsibility will be to look at helping guide and educate regarding the pandemic and the public health rules that are and protocols that are in place. But if anybody knows of good ranger candidates, please send them our way.
It's an important job.
It is a very important job.
And that's all the questions I have at the moment.
Just a quick last plug, if I could, Mayor, before you close. For our communication staff, again, they've been awesome helping us out on these briefings, but they do have two new platforms that you have access to watch our programming, and that's on Apple TV and Roku. I guess you can find us now on those two. Cablecast Screenweave is the app you will need. And if you search for that and then look for gco.tv, you can find us there and hopefully tune in that way too.
We're everywhere.
We're everywhere.
That's fantastic. Well, thank you all for joining us. Thank you, Councilor Dale, for being here tonight. Always great to see you, and excellent, excellent information. Really learned a lot from you. And again, thank you all for tuning in. We do have a city council meeting tomorrow night. It won't be on Facebook Live, but you can catch us apparently on a new app and the regular channels as well. So I will say good night and hope to see you all soon. I don't know if anyone else had any.
Good night, Golden.
Good night.
This was excellent, because I am very concerned that between all the people out for the rally on Sunday and all the businesses reopening and all the people coming to the park